Works. So. Works. So.
Entrepreneurial, leadership, intellectual, this is the Cultural Connections Podcast.
And good morning, everybody. My name is Brian Ives. I am the producer and the host of the Cultural Connections Podcast. Before I introduce our guest today, I want to remind all of our viewers here at home that we are recording this episode live on Thursday, October 24th, 2024. And we are recording this episode live stream to YouTube. So therefore, if you have a question here for our guest that you would like to ask during the podcast today, please feel free to comment below. As many of you may have seen yesterday, we started off a little bit, I would like to call a mini series here on the Cultural Connections Podcast, where we're going to be focusing and highlighting on the 5 ballot questions that are on the November ballot that's happening in less than 2 weeks from now. And we're going to be focusing in on the questions. I should preface this the fact here that here at the Cultural Connections Podcast, we have invited guests from both sides of each of the 5 questions on the podcast, specifically to have more of facts on why you should either vote yes or vote no on these questions. So we have reached out to all 5. We have gotten response from most of the sides of the questions. We're still waiting to hear back from a couple, but we are today on the podcast specifically are focusing again on question 4. Yesterday, if you saw our podcast, that would have been Wednesday, October 23rd. That episode focused on again, also on question 4, but on the no side. Today on the podcast, we're still focusing on question 4, but we're focusing on the yes side. And joining me on the podcast is Graham Moore. Thank you so much for joining me today.
Thank you so much, Brian. I'm happy to be here.
Thank you. And before I go any further, I would like, if you wouldn't mind giving us a little bit of a brief introduction to yourselves to tell our viewers a little bit about who you are.
Sure. Hi, everyone. My name is Graham Moore. I'm the Educational Outreach Director for Yes on 4. That means I'm kind of the home of the evidence on the campaign. My background is that prior to joining the campaign as staff, I was a grassroots mental health advocate, inspired by my experiences as a patient at Mass General Hospital and as a caregiver for 2 loved ones with severe suicidality leading to hospitalization, including my best friend who died by suicide. I have a family member who is a psychiatrist. I have friends who are doctors. I'm very familiar with what the highest levels of psychiatric care look like. One of my loved ones was hospitalized at McLean Hospital in Massachusetts, one of the best psychiatric hospitals in the country. And I'm very keenly aware of the limits of that and why we need additional options. So I'm here in support of what I believe is a life-saving measure backed by the evidence. And I'm happy to talk more about that with Brian and with anybody. So thank you so much for having me on.
Well, great. Thank you again so much. Just to again preface this to our viewers that do not know question 4, I should have said this at the beginning. Question 4 specifically states that if passed, it would be it would allow persons aged 21 and older to grow, possess, and use certain natural psychedelic substances in certain circumstances. And so that is the question to think about here and what we'll be focused on today. And again, why you should be voting yes on this question. My first question, and if you watch yesterday's podcast, you're going to see a lot of familiar questions because these are pretty much the same questions, but we're asking the exact opposite side of these questions. And this first question here for you is, what is a psychedelic drug? Let's start off the question for people that might not understand that fully when they look at this question. What is a psychedelic drug?
You'll get different definitions depending on who you talk to. So the opposition likes to define a psychedelic drug as a hallucinogen. That is a different definition than the National Institute on Drug Abuse uses. So not all hallucinogens are psychedelics, according to many psychedelic experts and the National Institute on Drug Abuse. So one definition of psychedelic is it's a certain kind of drug that affects serotonin receptors. Those are the classic psychedelics, which would be psilocybin in our measure, psilocin in our measure, mescaline, DMT, and LSD are sort of the big famous classic psychedelics, and they are psychedelics according to a pharmacological definition. In addition to that, there are called atypical or non-classic psychedelics like MDMA and ibogaine, which is in our measure. And they are considered psychedelics primarily because of the subjective effects, which are not, in fact, limited to hallucinations. The word psychedelic, I think, has to do with mind expansion. It's sort of the way these affect perception that makes them be called psychedelics. But typically, it's this idea that it expands your consciousness. Hallucinations, contrary to what some people say, are not the primary defining feature. MDMA, for example, is not associated with hallucinations typically. So that's a long into the weeds answer, but it's important because some hallucinogens like PCP are addictive. The things in our measure are not. So that's important to specify. There's a difference between hallucinogens and psychedelics, according to the National Institute on Drug Abuse, and according to our campaign chooses to go with that. So that's it.
No worries. Absolutely. Thank you. So then my next question then to you along the side lines here, and I get right into it here, is then what is the biggest reason people should be voting yes on this question, and what would be, I guess, well, let me rephrase that. What would be the implications of a yes vote? Why people should vote yes on this question, and if passed, what would happen in the Commonwealth of Massachusetts?
So question 4, a yes vote on question 4 is a vote for an evidence-based and compassionate policy benefiting veterans with service-related distress, benefiting patients with terminal illness or end-of-life diagnoses, and benefiting others with serious mental health struggles. It is a yes vote is supported by over 200 medical professionals, including leading psychiatrists, one of whom published an op-ed in the Boston Globe recently in support. It is endorsed by the Disabled American Veterans of Massachusetts organization, representing over 60,000 veterans in the state. And it is endorsed by Progressive Mass, and yes vote is supported by Elizabeth Warren as well. What this would do is it would create over the course of 2 years a therapeutic access program for access to these substances, which are all used as medicines abroad and have been used in certain communities for thousands of years. It would create a program for regulated, legal, therapeutic, and professionally supervised use of these substances over the next 2 years. And in addition to that, it would remove criminal penalties for personal use of these substances, including growing. But what it would not do is create a retail market. It would not allow people to buy and sell these on the street. That would remain illegal. What we're trying to do here is adopt common sense, not have people be arrested or threatened with prosecution for activity that research typically shows is typically benign, while at the same time not having this be a no-holds-barred cannabis-style commercialization environment where for-profit businesses are pushing this on everybody they can. So that's the balance we're striking, and it's rooted in the evidence. Where other places where decriminalization have been adopted, there's been no spike in DUIs or observed related increase in hospitalizations. In Colorado, hospitalizations related to psychedelics are actually lower than they were in 2020, even though they passed a measure just like this. So all of the fears of the opposition that you might have heard yesterday, it's important to keep in mind, they've never happened anywhere. And including in Massachusetts, where 8 cities and towns have already decriminalized growing and possessing these substances, you probably don't even know about it if you're watching this because it's been such a non-issue. So that was a long opening statement, but I think it's important.
Absolutely. No, that was a great answer. Then my next question, and you mentioned into what I wanted to jump into next, and that is about other areas of the country here that have enacted similar laws. Right? We did in yesterday's podcast here on the no side touch on this too, how 2 other states in the country, as you just mentioned, one of them being Colorado, the other one being Oregon, I believe, have enacted similar measures. what has been as a result of them passing similar legislation, you could call it, or similar laws of this type of thing? What has been the result of having these enacted in both of, and if there's any other place in the country that I was not list that I did not list, that what has been the result of this?
Thank you for that question, Brian. So there's actually three. It's
Oh,
Oregon, Colorado, and Utah. But Utah's program is the most recent, and so we sort of have the least data from it, or the least evidence from it. But Oregon was first. They have, and it's been in effect for more than a year now, a program for regulated, supervised access to psilocybin, just one of the substances in our measure. And what we know so far is that nobody's making a killing. There's this other misconception about this. This is some big for-profit thing. People in Oregon who are doing this as a business are largely doing this because they care. The profit margins are very slim because people typically access this treatment just once or twice in a year. In Oregon, over 12,699 doses of psilocybin have been legally administered in a controlled setting through this program, vastly more than have been administered in clinical trials. And what the initial data says is that this has been safe. So of all those 12,699 times, as of September 3rd, only 4 times were emergency services called to respond, and there were no deaths associated with that program. Anecdotally, it's been very, very effective, life-changing. If people go to our website, maformentalhealth.org, they can listen to the story of somebody who was impacted by Oregon's program. However, we're still waiting for efficacy data. I'm probably talking too fast, but I just want to
oh,
make sure people get the information they need.
of course. Now, you mentioned here, obviously, the importance of data. When you specifically state the fact here that there is not a sufficient amount of data still to be proven to show how well these laws work, how do you convince a voter to vote yes when there is still not a sufficient amount of data to prove these points yet? How do you actually prove that upon when you still don't have the data to go with it?
Oh, no, no, there's plenty of data. There's
Oh,
more than sufficient data. Just because we don't have efficacy data from
I
Oregon doesn't mean we don't have enough to support this measure. So let me explain, because this is where the opposition wants us to be on their ground, okay? There's no evidence that this is going to be harmful for public health, just to be very clear. So what we do have safety data from Oregon. We have safety data that haven't, the vast majority of people have had a safe experience. We have public health data from Colorado. We have arrest and hospitalization data showing essentially no change before decriminalization and after. In fact, in Colorado, fatal DUIs went down by 23.8% after their psychedelics measure passed. Do I think that was because of psychedelics? No. But it's important for people to understand nowhere in the world, the opposition can't point to a single place in the entire world, and these substances are all decriminalized in other countries for decades and have been for decades. They can't point to a single place where DUIs are observed to go up because of something like this, or hospitalizations, et cetera. So that's really, really important. The safety data in terms of the public health impact is impeccable. You look at the Netherlands, where psilocybin is available for retail. It's a normal country if you've ever been to the Netherlands. Amsterdam is a little bit funny, but the Netherlands is a big country. It's a normal country, and less than 1% of adults in the Netherlands even use psilocybin because it's not addictive. It doesn't explode through the population. So on the safety, public health side, the evidence is undeniable that this is not a threat. In terms of the efficacy evidence, we do have clinical data, not from Oregon, but we have data from clinical trials that, while preliminary, is astounding in terms of how effective these medicines appear, or at least certain ones, over existing treatments. So typically in clinical settings, and this has been repeated over and over and over again, I encourage anybody watching this to type in psilocybin and whatever, psilocybin depression, psilocybin OCD.
yeah.
1 or 2 doses is associated, and I'm using that word specifically, associated, because scientifically you can't prove causality until you have a big enough sample size, but is associated with dramatic, clinically significant reductions in symptoms that last months, and in some cases even years, just 1 or 2 doses. So that's astounding.
Yeah.
And all of these conditions that we care about, that I've suffered from, that people on our team have suffered from, don't have reliable treatments. That's really important to, 1/3 of people with PTSD are treatment resistant. 2/3 of veterans with PTSD are treatment resistant. And hundreds of people are dying by suicide in this country, in Massachusetts every year. Thousands of veterans are dying by suicide every single year. So the existing treatments don't work. We shouldn't stop people from using something that so many people have found to be life-changing and life-saving. This is about letting people do something that appears to be tremendously effective and has already been proven to be safe for public health.
Absolutely. No, I understand completely with what you're saying. And before I go any further, I do want to remind our viewers at home that this is the Cultural Connections podcast. We're recording this live on Thursday, October 24th, 2024. And we are talking about question 4 and why you should vote yes on question 4 today. We're joined by Graham Moore to discuss this further. My next question to you, which comes from a question that we're getting here on our live feed, which relates to the fact of psychedelic drugs and generally speaking. What is the risk of the fact that a psychedelic drug could cause a reverse reaction in certain behaviors? Is that a concern with passing something like this that psychedelic drugs could cause? I mean, what are the possibilities like something like that could happen if it could, if you know the answer to that?
A small amount of people have negative reactions to psychedelic drugs, just as a small amount of people have negative reactions to all drugs. Far less people have severe adverse reactions to the substances in our measure than to alcohol, than to cannabis, than to tobacco. I think something that a lot of people don't realize because we've become so used to it is, you may be aware of cannabis being associated with psychosis, but alcohol-induced psychosis is a real thing. Even tobacco, the connection is less clear with tobacco. We know alcohol can cause psychosis, but with tobacco, it's associated with worse psychotic illness. But a lot of things can cause severe adverse reactions to people in terms of mental health. And the biggest threats, and this is not even a close call, if you look around the world and the data we have, the biggest threats are not psychedelics. And on balance, what the observational research says is psychedelics cause more benefit than good, even in the community, more benefit than harm, even in the community. And the other thing that's important, I know somebody with bipolar. I know somebody who has manic episodes and you know how those end? Really severe mania, really severe psychosis. They end in arrest or they end in hospitalization. So when we say that this is not going to increase the public health burden, if you look at Colorado, we know that from what we know in Colorado. Like if this was causing a whole bunch of psychosis, like the opposition claims it will cause, you'd see that in arrest and hospitalization data in Colorado. You'd see that in the Netherlands. You'd see that around the world. You don't, because this just isn't that big of an issue. Can people have negative reactions? Sure. But in a large population study, classic psychedelics weren't even linked to psychosis. Doesn't mean it can't happen. It just means it's not statistically significant at a population level. So I hear the concern. Is nobody going to have any sort of bad reaction? No, but far more people will be helped. And if somebody is hurt, we think they should get medical help, not be arrested.
Right, absolutely. No, I get exactly with what you're saying there. Then my next question then to you here is thinking about this here, is you mentioned here, obviously in the United States, that there are 3, most recently being Utah, 3 other states in the country that have enacted similar laws. What makes it convincing to the fact when you think, okay, there are 50 states in the country and only 3 other states have enacted similar laws in effect now that they're making it basically legal in a way. How come you think now is the right time in Massachusetts to make this legal when it hasn't become more of into a national picture yet? Or do you think even maybe my next part to that question would be that someday that this should be a national, look into as a national picture, basically, and that it should be brought up more into a national attention than a state-by-state decision?
The right time to do the right thing is always now, and this is the right thing. So it is unfortunate that it has taken so long to get to this point where we're considering this reform in Massachusetts. It's important to keep in mind that all these substances were illegal in this country for hundreds of years and were only made illegal in the 1960s as a result of basically wanting to crack down on political dissent. That's what caused the war on drugs, not public health fears, but racism and a desire to crack down on the anti-war movement and the counterculture. So these substances are not more dangerous than substances that are completely unregulated or that are available legally and advertised on TV, like alcohol, and well, tobacco is more cracked down on, but like alcohol. So there's never been a public health justification. We are undoing a historical mistake here. And then the other important thing to keep in mind is that all of these policies have already been in place for decades abroad. Not the whole package, but for one or more substances. So the Netherlands, you've had legal psilocybin, including for retail, for decades. The Netherlands is a normal country. In many countries, you have Ibogaine decriminalized. It hasn't been an issue because people don't use Ibogaine on the street because it's not fun. Okay, and you've had regulated use of Ibogaine in New Zealand for over a decade, where it's used to treat opioid use disorder as a prescription medication. You have mescaline has actually been in a limited form decriminalized in Canada for decades. So again, all around the world, these policies have already been in place for decades. We're catching up to certain places and we're rectifying a historical wrong, and the right time to do that is now, not tomorrow, not next year, now.
No, I completely understand what you're saying. I hear obviously the idea that now is the right time, not later. I guess then my question to think about it is, yes, Massachusetts, what do you see as the future moves as we move forward down the line? Do you after it, let's say in 2 weeks, or less than 2 weeks from now, actually, question 4 passes. And do you see down the road other states, I mean, jumping on board and passing similar legislation as time I mean, what do you see as the next steps follow if this were to pass? What the next steps would be for other states across the country? What do you see happening from that point forward?
This is speculation, but I assume this model will be replicated. I think that if this passes, this model will be replicated, assuming that the regulated use portion, when it rolls out in Colorado, is a success. I think this will be sort of the model, or one of the models going forward. I do think there's a chance that in certain states, they decide to go with just psilocybin, because that is the most research that's been done on it. But I think this combination of decriminalization plus regulated supervised access is going to be the standard moving forward if this passes, as I think it should. So
now I'm curious to understand here for our viewers they may not know. As you mentioned again, there are these 3 other states, Colorado, Utah, and Oregon, that have similar enacted laws. But to my understanding, and from what I have read, is that these 3 states, what they have passed is different than what is on the is still a little it still has some differences than what's on the ballot here in Massachusetts. What are the differences between what they passed and what is being asked here on the Massachusetts ballot?
So Utah has the most restrictive program. Utah is a pilot program, meaning it sunsets, I think, in 2025, and it only applies to psilocybin, which is in our measure, and MDMA, which is not. So Utah is psilocybin and MDMA pilot program in hospital settings, and it's very new. That's the most restrictive program. Oregon's is regulated supervised access in clinics, essentially, for just psilocybin, but no personal use, no decriminalization in Oregon. Colorado's measure is practically the same as ours, except less restrictive. So Colorado's really made things a free-for-all in a way Massachusetts does not. So Colorado's did the decriminalization and they did the regulated use, but they went further in actually saying it's okay for people who are unlicensed to sell services in association with the substances. So in Colorado right now, it's legal to sell hugs and give away mushrooms. So it's a way to get around the restrictions on retail. Massachusetts law does not, or the question 4 does not have that loophole. Question 4 says you cannot give away any of these substances in association with a business activity or for remuneration. So Colorado's is much more of a free-for-all than what's being proposed for Massachusetts, but it does contain the 2 core planks of decriminalization plus regulated supervised access.
I see what you're saying. Okay, then my next question to you, and we're going to get to a viewer question after that, in a second, is that one of the parts of this question that struck me is the idea that residents would be able to, I forget the exact size of the space in their own home, grow these psychedelic drugs and these items in their own home. I know part of the other side of this in question 4, what was being talked about, is the concern of that this could open up a potential black market for people trying to on their own, even though, yes, it's illegal, it would be illegal if it was passed to sell on their own. How do you, obviously, how do you reassure voters that these drugs won't get, because people will be able to grow with them in their own home, that they won't get in the hands of people that don't need them?
Well, there's already a black market. That's why I always smile this thing. It's going to create a black market. There already is a black market for these substances. And in fact, what HomeGrow does is create an alternative to the black market, an alternative for people, especially vulnerable people, who otherwise might have to go to drug dealers who could introduce them to more dangerous substances or substances that are adulterated or who could abuse them under the influence. So HomeGrow is not creating a black market. There already is a black market. Let's be very clear. HomeGrow is creating an alternative to a black market. And it's also common sense. If people aren't selling these things, if they're growing them within their own home and not bothering anybody, why should we be wasting the resources of the state to lock them up or threaten them or harass them or fine them? It just doesn't make sense. And then the other important thing to keep in mind is this home growing thing, with even less restrictions than we have in our bill, is already a reality in Massachusetts, because in 7 cities and towns, resolutions have been passed that make arresting people for personal use and growing of these substances the lowest law enforcement priority. They've effectively decriminalized it, including Cambridge and Somerville since 2021, right next to Boston. And we haven't seen an explosion in the black market. Ask the opposition. Oh, what happened in Cambridge and Somerville? There's no explosion of the black market. There was no explosion of use. There was no explosion of DUIs or anything, or any observed impact whatsoever, actually, which is why most people still don't know. This has already happened in Massachusetts. It hasn't been a big deal. It won't be a big deal. This is a common sense thing to create an alternative to the black market and to not prosecute people for activity that is benign. Again, if they sell drugs, as people are selling drugs now, they can still be arrested by law enforcement just as people can be arrested now. And driving under the influence, by the way, will continue to be illegal.
Right, of course. Then my next question to you, and this comes from a viewer question here, and before I can get into that, I want to remind all viewers at home that this is the Cultural Connections podcast. We're recording this episode live on Thursday, October 24th, 2024. And we are talking about the 5 ballot questions today on the 5 ballot questions that are on the ballot here in Massachusetts. Today being focused on question 4 and why you should vote yes. And we are joined by Graham Moore, the educational outreach coordinator for the vote yes on 4 question. My next question, which comes through, is to a more of a viewer question, more on the ends of psychedelic drugs in general. And this person wants to know if psychedelic drugs can be looked at as a cure to mental illness, and then I mean, or is it something? I mean, what is the rate of it really being the success rate if it was something that this was surpassing, like really making the difference to some people with like different, like you talk all about different mental health conditions? Is there a good success rate with psychedelic drugs actually helping people with mental illness?
Okay, so there's different ways to answer this question. And there's the evidence and then how you interpret the evidence. One of the prominent opponents of this measure likes to claim that these drugs are just symptom relief, essentially. There's still a debate there, but proponents of this, including many medical professionals and myself and many other patients, believe that these are curative. That's what we believe. I mean, you can look at the data and you can see what nobody can deny is that 1 to 2 doses of these drugs are associated with months and in some cases even years of clinically significant relief. And you can look at that and you can say it's just the best Tylenol ever. It lasted 2 years. You can look at that and say, oh, maybe it was the placebo effect that lasted 2 years. Or you can look at that and say, hey, this had a disease modifying effect. This was curative. And what leans me in the direction of this is curative is that has been my lived experience. So could it have been the placebo effect that seems to have cured my crippling, severe, debilitating OCD that didn't allow me to work normally, that didn't allow me to take a walk without worrying about really insane things, that made me scared to take a deep breath because I was worried about the germs in the air and all this crazy stuff? Was it the placebo effect that's allowed me to live a full life without requiring daily, weekly, or even monthly medication? I don't 100% know, but I will know that my experience has been that psilocybin in particular appears to be curative. That is the experience of many people. And as far as where the data is, the association is undeniable. People have taken 1 to 2 doses and their addictions have gone away. Now again, could be placebo effect. I'd love to have more research done. In the meantime, let's not arrest people for something that appears to cure addiction, okay, and isn't harming people at a statistically significant level anywhere. I think that's the key thing here.
Absolutely. Well, hard to believe we're already reaching towards the end of our podcast. I always say a half hour to 40 minutes always flies by quicker than you expect it to. I'd like to give you the final words here on one more time again, expressing to our viewers here why they should vote yes on 4 and why you're advocating for voting yes on 4.
Please vote yes on 4 to make a potentially life-saving treatment option available for people who really need it and for everybody who could benefit, and also to make psychedelics use in this state safer. The question you're being asked is not should or should not people use psychedelics. People are using psychedelics in this state, and they're going to continue using them so long as the existing treatments don't work very well. And they don't. That's very obvious. It's obvious from the data. It's obvious from the anecdote. If you know anybody who's on antidepressants, statistically, most likely they're not loving it. Okay, the existing treatments don't work well, so people are going to continue seeking to use psychedelics. Right now, there is no regulation, and if somebody's harmed in the underground, they have to worry about coming forward. I know somebody or know of somebody who was blackmailed by a psychedelic facilitator in this state who threatened to tell their employers about their activity and extorted money from them. Okay, that's a reality in this state. That person would have been better off had decriminalization already been in place. I similarly know somebody who is seeking access to underground psychedelic therapy. I told them not to do it because they were being charged $2,500 for somebody they didn't feel good about, and that wasn't good for them. You know, this space needs to be regulated, and people need to feel safe to talk to their loved ones and healthcare providers about their healthcare decisions around this. So please, please, please pass this. It's going to save lives. It's going to help a lot of people. And it's going to make our state a healthier state. So thank you so much.
Absolutely. And one more time, the website for people who want to learn more about why yes on 4. What is the website one more time? MA4mentalhealth.org. So MAFOR mentalhealth.org. Okay, perfect. And we'll have that linked in the description of all here on all of the different platforms for the podcast, for wherever you're watching or listening to. It'll be available for you to access that link for more information. Well, I want to thank you again, Graham, for this very enticing conversation on why people should be voting yes on 4. I think it's important, obviously, for people to really not just obviously understand this question, but all of the 5 ballot questions. And I'm glad. Thank you again for taking the time to join me today here on the podcast, on the Cultural Connections podcast. If you have questions or comments or would like to submit ideas for future ideas of the Cultural Connections podcast, please feel free to email me directly at brianives@gmail.com. That's BRIANIV as in Victor, ES @gmail.com. And we obviously get back to everyone that gets in touch with us about ideas for episodes of the podcast or questions or comments related to the podcast. So again, thank you to Graham for joining me today. If you are staying with us, stay tuned, because tomorrow on the podcast, we are starting our next question. Tomorrow, October 25th, that'll be Friday, October 25th, we will be having on representatives starting with question 5 on the podcast. So we're moving along here. Not in the order that I had anticipated, but we are moving in a direction of starting and getting in more questions here as we can before the November election. Remember, the election is on Tuesday, November 5th. So if you vote, early voting is now available. If you haven't voted yet, you can do so now by early voting, or you can obviously wait until election day and vote on November 5th. So again, please remember to vote if you are eligible to vote. So thank you again for watching the Cultural Connections podcast. I'm Brian Ives. I'm the producer and the host of the Cultural Connections podcast. Thanks for watching. Oops.
Thank you.
Hold on 1 second. Oh, shoot.
Thank you again for watching this episode of the Cultural Connections podcast. For more information on today's episode, be sure to check out our social media pages on Facebook, Twitter, and Instagram. You can also watch this episode again in its entirety on our YouTube channel. This podcast is also available on listening platforms Spotify, Apple Podcasts, Google Podcasts, Pocket Casts, Breaker, Radio Public, and New TV. Thanks again for watching this